Hello. I'd like to acknowledge the traditional owners of the land where you're gathering. And I'm recording this message on the lands of the Wurundjeri people, and I pay my respects to elders past and present from both regions and extend that respect to all First Nations people taking part. Now, can I please thank everyone at the Consumer Health Forum for inviting me to speak today. The work you all do to achieve safe, good quality, timely healthcare for all Australians couldn't be more important. As the national peak body representing the interests of Australian healthcare consumers, you draw on the knowledge and experience of consumers and our community to drive innovation and improvements to our health and human service systems. So thank you. Thank you for your advocacy, your research, your health literacy work, and everything else that you do. Now, today you've asked me to speak particularly about the work underway to reduce the gender bias in healthcare, as well as our work addressing the health-related consequences of climate change. As a former nurse, a mother, a grandmother, and a women's rights and climate activist, I can't think of policy areas I'm more passionate about than these two. And let me assure you, the Albanese Labor government is committed to action. Now, in Australia, a disproportionate number of women experience delayed diagnoses, over and under prescribing, and don't have their symptoms properly investigated across a wide range of conditions and diseases: cardiovascular disease, ADHD, autism, and endometriosis, just to name a few. Now, I've established the National Women's Health Advisory Council to provide advice on how we can end gender bias in the health system. And it includes some of the best and brightest women in the country. One of them is the fabulous Dr. Elizabeth Devaney, Chief Executive Officer of Consumer Health Forum. I am so proud to be working with you, Elizabeth. You're amazing. Last year, we launched the End Gender Bias Survey to hear from thousands of women on their experiences of healthcare. And too many recounted personal stories about bias that, sadly, well, not surprising, were actually shocking and saddening nonetheless. Women feel dismissed and disbelieved, stereotyped as hysterical, a drama queen, faking it, and their concerns were inadequately investigated. Now, these experiences are compounded if these women are from a CALD background, in the LGBTIQA+ community, or are living with a disability. They're stereotyped again as hysterical and a drama queen and faking it. The reality is there's not enough research on the female physiology and symptomology. I am determined that these women's stories will help us write a new chapter in women's health in this country, which is why in this year's budget, we invested over $160 million in a tailored women's health package. It includes things like free period products for First Nations women living in remote communities, support for women who have experienced a miscarriage, better support from midwives, better data, and most importantly, it builds on the work we've already done, including our 22 endometriosis and pelvic pain clinics, and equally distributing the NHMRC's investigator grants to women and men. And I know I can count on your help with this. Similarly, I look forward to working with you as we tackle the health impacts of climate change. It's a national priority for us. Last December, I was very proud to launch Australia's first National Health and Climate Strategy. Now, this sets out a whole-of-government plan over 5 years to address the health and well-being impacts of climate change, while also addressing the contribution of the health system to climate change through its generation of greenhouse gas emissions. The Consumers Health Forum provided a comprehensive submission during the strategy's consultation, which was right across the country, and I thank you for your contribution to that process. The government is working hard to implement the 49 actions laid out in that strategy and has already made great progress. We're collaborating with the NHS England, the US Department of Health and Human Services, and several other countries to decarbonise health system supply chains globally. We're working with the British Standards Institution, medicines regulators, pharmaceutical companies, and other stakeholders to develop international standards measuring the carbon footprint and other environmental impacts of medicines. We're working with our colleagues in the Department of Climate Change, Energy, the Environment and Water, or DQ, and the CSIRO to assess risks to health and wellbeing. And we're developing a health national adaptation plan that has all levels of government and the private and community sectors working on the health and wellbeing impacts of climate change. Now, this is not an exhaustive list, but I trust you agree that it's a measure of the importance we are placing on climate change. We're determined to effect change, along with tackling health, gender bias, which for too long, and I mean far too long, has bedeviled our health system. I look forward to working with you, your organisation, to do just that. Good luck for the rest of your AGM. Thank you.